Hello everyone. So today we are going to discuss about refractive errors or the errors of the refraction. So the errors of refraction or refractive errors is the state, or we can say it, the condition of ametropia, right? So a patient comes to you. How do you know that is he ametropic or emetropic? There are two terminologies. So before moving to the errors of refraction, we should know that what is a condition which causes this, right? Ametropia is also known as refractive error. Now what happens in a normal condition, that rays of lights are focused on directly or exactly on the fovea when the refractive power of an optical media correlates with the axial length of an eyeball. So what happens over here, you can understand with the simple phenomena or simple technique, that the light rays, when they are focused on the fovea, the image is very clear, right? You all know that macula or the fovea is the part of the eye that gives the sharpest vision, right? So when the light rays are exactly focused and the patient's eyeball is normal eyeball length is approximately 23.5, or we say that it's 24 millimeter. But if it crosses this limit or it extends, the eyeball is either the eyeball is enlarging or it's shortening, so it can cause the change in the axial length of the eyeball, right? And the power of refractive power of an optical media is overall the eyeball exerts a power of, or it contains a power of approximately 58 to 60 diopters. That is the refractive power of the cornea as well as the power of the lens, right? So when the power of the eye is normal, axial length is normal, and the rays are focusing exactly on the fovea, so that is the normal condition, and we say this emetropic state, right? Patient has a real acuity on the snellen, which is 6 by 6. But what are the causes of refractive error? How a patient turns into the ametropic state, from emetropic to ametropic state? When a patient comes to you and his real acuity is not 6 by 6 on the Snellen chart, but when you did pinhole test of that same patient, his real acuity gets improved and it's up to 6 by 6, that means that it is a state where patient is having some error in his vision, right? So that is a refractive error. So what is over here happening, when any of these two factors don't correlate with each other, the rays of lights are not focused on the fovea of retina. So we have three conditions in ametropia, that either the power of the eye is changed, axial length of the eye is changed, and the rays of lights are not focused exactly on the retina, right? So that is why refractive errors come. There is a very important thing to understand, that when you are doing refraction, clinical refraction, it's either subjective or objective. You should know that what is the difference between refractive error, what is the difference between pathologies, macular pathologies or any other pathologies, right? So if a patient comes to you and on the Snellen chart, so while doing the while checking his real acuity, you came to know that patient is not 6 by 6, but when you perform pinhole test and his vision gets improved and it's now 6 by 6, right? So that means that it's refractive error in that patient's eye, right? But if it's not 6 by 6, it means that patient is having any other pathology or any other problem in the back side of the eye, right? So over here I have discussed in the back about emetropic state. So emetropia is a normal state. It is a refractive state of an eye where parallel rays of light coming from infinite distance, right? From infinity means that the light coming from distance, so they are always parallel, so they are exactly focused on the retina while accommodation is at rest. Okay, so this is the emetropic state where patient's real acuity is exactly 6 by 6, so we consider it as a normal vision. Now what is the ametropia? It is a refractive state of an eye. If someone asks you what are the refractive states of an eye, you should know that there are two refractive states. It can be either the eye can be emetropic or the eye can be ametropic, right? So ametropia is a refractive state of an eye where parallel rays of light that are coming from distance, it can also come from near, but we have taken a standard that any rays of light which are not focused on the retina while accommodation is at rest, or it can be that patient's accommodation is exerting but still the power of eye is not as much as it should have, right? So the light rays are not converging properly and on timely as we have in the hypermetropic state, right? So there are three types of ametropia. These are hypermetropia, myopia, and astigmatism. We are going to discuss these step by step in the coming slides. Now, what is hypermetropia? It is also known as farsightedness. Now, what does farsightedness mean? It means that a state where patient has better I'm not saying accurate or total accurate far distance, far VN, right? I'm saying it's still better than near. Okay, so any patient coming to you with the hypermetropic problems, he will say that he is facing difficulties in near objects, in near VN, but his far VN is better as compared to the near one. Okay, so it can be farsightedness, or we can say it long-sightedness, and this is the type of the refractive error where light rays are focused behind the retina. Very important point, that light rays are focused behind the retina in hypermetropia. So what happens over here, that patient is facing the near problems. In the video of accommodation of the lens, I have told you the state of presbyopia, but I have told you that what is the role of accommodation over there. While focusing the near objects, what happens, that divergent rays of light are coming from the near or close up objects, right? So in order to focus those divergent rays, the eye needs more power, right? So the eye needs more power to converge, but due to the less eye power in hypermetropia, what happens, that the power of the eye is so less that it does not converge the divergent rays of the light coming from the near objects timely onto the retina, right? So that is why they converge slightly behind the fovea or behind the retina, which causes a problem for the patient to see the near objects, right? So diverging rays of light are focused behind the retina due to less converging ability, right? I have told you in right now that what happens in hypermetropia, refractive power of the eye is very low. What happened, why is it so? Because the accommodation in the eye is not exerted as much as it should. Okay, eye becomes weak. If someone says that what is weak eye, you can say that the eye in which the power of the eye is reduced, we can say it weak eye, or axial length of an eye becomes short. So over here you should know very important thing, that there can be two concepts. I have already told you that either the power of the eye is very low, or we can say less, or either the axial length can change. We will discuss these very in detail, but just to know that what is hypermetropia right now, you should know that it in this, either the eyeball length is shortened, right? Axial length, I have told you that it's the length of the eyeball, and its normal is, we consider it up to 22 to 24, or the ideal is 24 or 23.5 millimeter. But if the eye becomes more short, it can be 20 millimeter. So what happens, that light rays are focusing on the exact position of the retina when eye was on the normal state, but now eye has become shorted, eye has shortened down, or eye size is short. So that is why rays are, we think that okay, rays are falling behind the eye, but actually what is happening, it is focusing on the exact point when the eye was in the normal length, right? So what is happening over here, eye छोटी हो गई है, but light rays जो है वो अपनी जगह retina पे ही fall कर रही हैं. So that is why we can say that light rays are focusing behind. Or the other concept is that the power of the eye is so much less that it does not converge the divergent rays coming from the near objects exactly on time, right? So over here you can see that 25 centimeters near distance, light rays are focusing over here behind the retina. So either the eyeball size is shortened, you can consider that normal length was this of the eye, light rays are focusing over here, but what happens, eyeball becomes shortened. Or the other concept can be that the power of the eye is so less that it does not converge these these divergent rays on time, because the power of the eye was less. So now how can we treat hypermetropia? We can treat hypermetropia by convex lens, because we know that in convex lens has the ability to converge more, right? Convex lenses are the converging lenses, so it has the ability to converge more. So what will happen over here, that I have already told you that in hypermetropia the power of the eye is reduced. So when we will add a convex lens, right? So what will happen over here, that if the power of the eye is 58 diopters, the power of the convex lens will be added into it. Convex lenses are the plus lenses, or if they are the converging lenses, right? So the power 58 plus 2 diopters, it can be 60 diopters, or 60 plus, depending on the power of the eye and the power of the lens. The eye power can be increased so that light rays coming from the near object are focused timely on the retina, right? And there can be another thing, that the divergent rays coming from the light from the near objects can converge more, right? So what will happen, that when these rays will divergent rays will get converged, they will focus on the retina timely. Now, what is myopia? We can say that it is a nearsightedness, and it is a state in which patient is capable or has the ability to see near objects clearly as compared to the far. Patient has difficulties in watching or in identifying distant objects. So this is the state of retina in which, it is a ametropic type where the light rays are focused in front of the retina, right? So when they are focused in front of the retina, what is happening, the parallel rays of light that are coming from the distance are focused in front of the retina. Why are they focusing in front of the retina? Because of the more power of the eye. They can be due to the more power, converging ability is so high that they are focused before the retina, or they are not focused on the time, but they are focused before the time, right? So the parallel rays of light are focused in front due to more converging ability. Refractive power is very high, and eye is very strong over here, and eyeball length is elongate. Now eyeball length can be elongated over here, that retina was light rays was focusing exactly on point, but what is happening over here, that eyeball length is elongated. So that is why we consider that, oh, it's fine, light rays are focused in front of the retina, right? So there are other more further types of these ametropic conditions like hypermetropia and myopia. We will discuss in detail in other lectures, but right now we should know the basic things of these errors. That is why I'm just telling you in very short manner that what are these ametropic states that you should know. So over here you can see that parallel rays of light coming are focused in front of the retina because of the more power of the eye, right? So, or you can say that it was retina was over here, normal retina was here, but due to the stretch of the eye, due to the stretching or the elongation, the retina is behind and the rays are focused in front before time. There are two conditions over here. As I have already told you that they are further classified into different types, but we are discussing right now the introduction on the basic level, so that is why I'm not getting into the much detail. What is important for you to know is right now that the rays are focused in front and power of the eye is very high and eye is very strong over here. Got it? Now how are we going to treat the myopia? We can use concave lenses, because concave lenses are the minus lenses. If the power of the eye is very high, it is 60, so we need to reduce the eye power. So that is why we use concave lenses, because they are minus lenses, or they have the property to diverge the light rays, right? So they are also known as the diverging lenses. So the light rays that are coming from the infinite distance are diverged, first diverged, and then they converged on a single point so that they can focus timely on the retina. So that is why we use concave lenses in the to treat the myopic conditions. Now, very important, there is a third terminology or third state of the refraction, ametropia, that is astigmatism. And it is that type of refractive error where the light rays are focused at more than one point. As you can say that stigma means point and a means not, so there is not a single point, there are more than one fixation point or focusing point. So rays of the light are not focused on the single point in the astigmatism. So there is a confusion for the patients to identify things. They are facing headache problems. And what are the types of the astigmatism? There are two basic types of astigmatism. There can be regular astigmatism or there can be irregular. Two basic types, regular or irregular astigmatism. And regular astigmatism has further three categories. We are going to discuss it over here today. So over here you can see that regular astigmatism, in this condition there is difference between the two meridian is 90 degrees, right? So both meridians are 90 degree apart. You can see over here the vertical meridian is 90 degree and the second meridian is 180 degree. It can be oblique, it can be you can see straight, but what is happening, the angle difference is 90 degree. 180 minus 90, it's 90 degree. So the angle meridian difference between the meridians is 90 degree. So this is regular astigmatism, right? There is some regularity or there is some pattern over here. Now, what is the type with the rule astigmatism? Over here you can see that this is a vertical meridian and this is a horizontal meridian. You can see that horizontal meridian is very flat and the vertical meridian is steep, right? It's somehow steeper than the flat horizontal meridian. So with the rule you can just remember it, that there is a nature's rule in our eye that eyelids are cornea, right? This is our cornea. So eyelids are having or some pressure on this cornea. So that due to that pressure, what will happen, that the vertical meridian or the vertical diameter of the cornea is less, and the power of this hair power is more because of this steepness. So what will happen, due to this pressure over here on vertical and horizontal lids of the cornea, this vertical meridian is steeper and the horizontal meridian is flatter. So this is a nature's rule, and we say it with the rule astigmatism, and astigmatism is related with the cornea and with the lens, but we are more concerned with corneal astigmatism because there can be many changes in the corneal surfaces which can cause astigmatism, right? So astigmatism is caused due to the any change in the cornea surface. That is why we have said that these are the corneal meridians, right? These are the corneal meridians. So in regular astigmatism, there are changes in these both meridian. Power can be difference over here. Power difference can occur, right? Over here in the with the rule astigmatism, the horizontal meridian is flatter and the vertical meridian is steeper. So it has more power as compared to the horizontal. Now over here, against the rule astigmatism, that the horizontal meridian is more steeper, it has more power as compared to the vertical meridian, right? So this is against the rule because I have already told you that it's nature, by nature we have some pressure on our corneal vertical surface, because that is upper and lower eyelids. So due to that pressure, the cornea is more steep in the our vertical region and more flat in the horizontal, and it has more less diameter, vertical diameter, and more horizontal diameter, and it has more power in vertical diameter, vertical meridian, and has less power in the horizontal. So in the against rule, it's totally opposite, that it's against the rule of the nature. So that means that horizontal meridian has more power, it is more steeper, it has less diameter, and this vertical meridian has less power, has more diameter, and it is having the less, it is flatter, right? So now oblique means that it's not straight, they are not vertical or horizontal, they are in this manner, oblique manner. So it can be, if it's 80 degrees, so it is 90 degree apart, but are 90 degree apart. Regular means that both of the meridians are 90 apart in the cornea, if there are any changes in the cornea, right? So in any meridian. So oblique means that it lies between any of these. They can lie between 45 to 135 or 140, I guess, and we will discuss these degrees later. But right now you should know that what is oblique astigmatism. They are not in vertical or horizontal way, but they are a bit tilted, but are 90 degree apart to each other, right? So 170 minus 80 is 90 degree. Now what is irregular astigmatism? There are no specific there is not a specific rule over here. Okay, so both the meridians are not 90 degree apart to each other, and it can occur in a keratoconus case or any traumatic state of the cornea. And keratoconus is a state in which the cornea becomes conical, right? So what is happening in irregular astigmatism, that these two meridians of the cornea are not 90 degree apart to each other. So you can see over here it's 180 degree, so it's here 45 degree, so their difference is not 90 degree. So this is what they are telling, that what is irregular astigmatism. This was all about our errors of refraction. If you have any query, you can comment in comment section. Thank you so much.